Hey everybody, how you doing? My name is Craig Langemeyer and I am the Chief Ministry Officer here at Pine Cove. Get to work with all the different camps. And I am joined today with Pine Cove's Chief Medical Director, Dr. Scott Lawrence. So good to see you, Scott.
Yes, good to see you, Craig.
Excited to be able to share with you guys as a staff team kind of what's going on this summer. I know there's been a lot of questions about camp and what's happening. I just thought I would love for you guys to hear from our Chief Medical Director, his take on it. But before we get into his take on this thing, I'd love you to introduce yourself. Tell you a little bit our history, or your history with Pine Cove.
Okay. Actually, I've been with Pine Cove now. I'm going on my 12th year. And I started in 2009 when swine flu hit. So I have a lot of experience with viruses spreading through the camp. At that time, we put in a fairly robust camp clinic that has grown to the ability to do x-rays, labs, IV, medications. We hire over 300 nurses a year to help us with that.
You said 300 nurses.
Yes.
Wow. Okay. So what you're saying here, you've been here a while.
Yes.
You've seen a thing or two.
That's correct.
And been involved with really building our whole,
Yes.
You guys need to know this. He has built our medical program the way it is, the different clinics that we have, the ability, we have the ability to do x-rays.
Yes.
We have the ability to maybe test or search for if somebody has COVID-19.
That's correct. We do have
Yeah, we do have that, people. Hey, let's go through this a little bit. Regarding how we're going to be handling, or how can we, as a Pine Cove group, be assured that we're going to be running a safe camp operation, that we've got the ability medically to engage with campers and staff?
Okay, that's an excellent question. First of all, we've been digging into the CDC and state guidelines as to kind of guiding us as to what keeps a camp safe, what keeps an environment safe. And we're also looking into different data to look at what tends to work or not work in different environments. So that's kind of guiding overall what we're doing, but we've kind of divided this into three different sections. The prevention of this COVID-19 getting into camp, that's one component of how we're structuring it. And then one, to mitigate any kind of disease spread within the camp. And then there's a follow-up component where we're going to follow up with campers and make sure that at the back end, people didn't get sick and we didn't know about it. So it's kind of a three-tiered kind of approach.
So what are we doing on the front side as staff are coming to camp? Again, this is obviously a staff group here, but as staff are coming to camp here in the next few weeks or so, what are we doing to help in that process?
Okay, we'll be sending out, if we haven't already, you haven't received it, there'll be a questionnaire that kind of goes for the classic CDC kind of guidelines of what you look for of people that are higher risk for gaining COVID-19. An example would be, have you been in contact with someone who has tested positive with COVID-19 in the last 2 weeks?
Right.
Questions like that. Then when you come in, before you're allowed into camp, we have thermal scanners that will basically check the temperature of anybody coming into camp. That will be an ongoing throughout the summer that we do. So as you come into camp, we'll do a scan on you. We've also sent out a questionnaire to look at different kinds of comorbidities, just to kind of look at people who might be at a little bit increased risk on that. We're bringing people in early so we can watch you and kind of quarantine you for a period of time and make sure everybody's stable, nobody's sick. If for some reason on arrival someone has a temperature, and we're screening at 99.5 is our temperature screen. Now you don't typically, you aren't sick till you hit 100.5.
Okay.
But I found in swine flu that people would slowly run their temperature up, and so a screening temperature of 99.5 caught people a lot earlier.
On the front side.
Yeah, exactly. And if in fact you do test positive on the temperature, then we're going to do a COVID-19 active test on you, and probably also a COVID antibody test on you. The antibody looks to see if you've had it in the past, in the last several months, and then the active test determines whether you have it right then.
That's awesome. Okay, so if somebody, well, let me rewind.
Okay.
So when they get to camp, we talk about a little bit of maybe quarantine, where people are and by quarantine, camp quarantine, that we're staying at camp for a period of time. Some people have asked, what are we going to do about laundry? If we can't go into town, all that kind of stuff, that's not a question that you're going to know the answer to. But your camp director will know the answer to, and we are figuring that out. So if that question is hitting your brain, or maybe better your mom's brain on how are you going to have clean clothes for the summer, you can rest assured we've been taking care of this in a lot of different ways. We've had 2-week campers for a long time, and we find a way to coordinate with somebody in the town or locally that can take care of that laundry for us or work with us if we can't go into town. So we've got you on that, people. And I will tell you this, side note, make sure you get your theme night stuff before you get to camp. That way, if you can't leave camp, you're covered. Okay, back to medical stuff. That was almost like a commercial, really,
right,
for what we should do
True.
outside of the medical side of things. So if someone gets sick, they're at camp and they end up getting sick and test positive for this or any other kind of sickness, how are we handling that? How do we do that with quarantine or taking care of them?
Okay, so that's an excellent question. Our objective is we want to keep this disease out of our camp. And if it ends up showing up somewhere, we want to identify it as quickly as possible.
Gotcha.
So we're going to do every morning, probably at the breakfast time, we're finding that's probably going to be the best time. We're going to do temperature checks on everybody to identify whether you have a fever above 99.5.
Yep.
And if in fact you do, then you'll get pulled to the side. You're going to get a COVID-19 test, probably a cool down for 30 minutes.
Yep.
You know,
Right.
make sure that it's a true temperature. You'll get tested for that, and we'll once we have a feedback, if it's positive, then we'll end up having to send you home. If it's negative, then based on kind of what your other symptoms are, we'll let you recover from that and back into camp. Now, a lot of people have said, well, there's going to be a lot of asymptomatic kids. That
Yeah,
are
what do
out
we
there.
do about that? How do we, what does that look like?
Okay, so in fact, I just got off the CDC website today looking at that in kids, and it was interesting. Probably in looking at the details of that, only 4% of children have no symptoms whatsoever.
Interesting.
55% have just mild symptoms, but of that, fever is one of them. So
Gotcha.
essentially 96% of kids or young people will have some symptom. Almost all of them will have some level of fever. So temperature screening is an excellent way to catch early what we might see. And because we're in camp and because we're going to be looking at this on an ongoing basis, we're going to see subtleties that they wouldn't see if they were at home or they were at school. We're going to see those a lot earlier and pull them out, screen them, and do a COVID-19 test if we need to.
Awesome. So y'all, we are going to be taking great care of you. We're going to make sure the best we can that we're identifying folks that might be coming in with it. If somebody gets here and they have this disease, we're going to be able to identify, test for it. And I can tell you and rest assured, we're not going to put somebody with COVID-19 back into camp action, but we also understand some of you are driving from a long distance away to camp. And so we'll be sensitive and coordinate with you, having you away from the rest of the staff, but get you back to you maybe have a 12-hour drive to get back home. We'll work with you on that. And folks that live close or locally, we can get them back, back to their homes much more quickly. So, all right, let's talk a little bit about social distancing. Okay, so we've got, let's deal with this. How are we handling social distancing in this?
Well, that's an excellent question. There's been a lot of coordination between the medical side and the operational side, but I'll let you answer that question.
Oh, perfect. Q&A session just flipped on us, people. Okay, so social distancing at camp. Y'all, I will tell you this. First off, everything that we're doing from temperature taking, tests that we provide, what we're doing in terms of opening camp and how we're going to be operating activities and meals and all that will all be within the guidelines that are recommended by our governing authorities. Y'all, we are not going to be mavericks and jump out in front of this. We want to make sure we know that there are people that are much smarter than us, that have access to resources that are much greater than we have access to, who are making decisions about when we open up our economy, when we open up social interaction, and when we may need to close it back in. And so I just want you to know we are going to be operating even very much so within whatever those boundaries are. So you need to know that as we're going forward on this. In terms of social distancing, same applies. We're going to be within whatever is recommended with the government. Now, how do you do that with kids? How do you do that with young kids? Are they going to be wearing face coverings? Are we going to? I'll tell you this: we are providing face coverings for our staff and for our campers in the early summer for sure. If this it continues to be the method that is best outlined by our authorities, and have the ability to do that. So if some kid is, for example, getting harnessed up to get on a zip line, that instructor would be wearing a mask if he is a mask, or a covering is probably a better way to say that, as he is close, and kids will as well, as best as we can keep these on kids. And we will do a great job of making sure that we are adhering to the numbers of folks you can have in a room. So if you can only have 100 people in a room at any particular time, and we have 200 people at camp, we'll eat in different meal shifts, or we'll find ways to have some folks eat outside while others eat inside, and we will be working with this in creative ways on this. So you guys need to know how we're going to be taking care of those things, even in the ability on the I'll say on the eating side of things. Y'all, we have the ability to, instead of doing family style meals where everybody's touching the bowl and the scoop that goes back into the food of whatever that is, that we serve plate by plate. The ability to have a very thorough situation where we can wipe down and sanitize door handles and chairs and tables and everything within that. And Dr. Lawrence has worked with us and making sure that he's got all the sanitizer ordered. We do have that ordered, right?
Yes. In fact, we look at the EPA website, CDC, and only use those products that are recommended for killing this virus. So we're very specific on the type of sanitization we use as well.
Yeah. So y'all, we're paying attention to the details. I can tell you from knowing Dr. Lawrence for the last 12 years that he is outstanding at what he does. He has kept us healthy and safe over the years, and if the government and the Lord Jesus allow us to do camp this summer, we're going to do it in a safe and healthy way, and we're excited about that.
Greg, I'd like to make one point too. You talked about following guidelines. I would say probably in many ways we're exceeding those guidelines. We, on temperature scans, they recommend 100 degrees as the temperature to screen for. We're screening at 99.5, where we have a robust capability because of our health care on site to be able to do this thermal scan testing on a daily basis, to do active testing, contact tracing, all of those things that aren't available in restaurants or schools or those things. And because we have that capability and we can stay on top of this more aggressively by doing that, we're going to do it.
That's great. Awesome. Well, I do want to say thank you to Dr. Lawrence for joining us here today. I want you to know we're excited about whatever ministry God has for us this summer. I was reading y'all in Luke chapter 21 this morning, and it was about kind of the end times. This is Jesus talking, and he was speaking about the times when there are going to be plagues and pestilence, and there are going to be the destruction of Jerusalem, and like all of these terrible things. And he reminds at the end in verse 28, it says in Luke chapter 21, verse 28, now when these things begin to take place, now listen to this, people, when these things begin to take place, straighten up and raise your heads, because your redemption is drawing near. And if Jesus can give that to us as an encouragement in the craziest of times at the end times, certainly at this time, it's a good word for us to straighten up and lift our heads and run into this with a joyful, dependent upon the Lord mentality, knowing that he is our redemption. Y'all, we love you. Thanks for joining us this summer, and we look forward to seeing you soon.
Look forward to it.